Hey, welcome back to What's Up, KWAT. Dr. Dan, good morning, sir.
Hello.
Good to see you. Dr. Dan Reiffenberger is in to talk a little bit about convenient care this morning, right?
Yes.
We love when care is convenient, so what does that mean?
We're trying to make access to the clinic as easy as we can. We have it designated at our Brown Clinic, Prairie Lakes Brown Clinic, Northridge site, and it starts at 7:30 in the morning until 6 p.m. at night. You can always call ahead of time and see if there's an appointment slot that works better for you. If it doesn't, or you have to make arrangements for a ride or anything else, okay, you come when you can. And then we will get you in and get you taken care of. And it's designed, we can't plan the day. Something comes up all of a sudden, we get a cut, fall, bruise, colds, coughs, anything. We'll hear a lot of times that people aren't sure, do I go to the clinic or do I go to the emergency room? If you're not sure, you always can come to us first as we're evaluating if there's anything that is more involved, and then we'll help make the decision of whether or not we need to go to the emergency room or not.
And no appointment needed,
And no
right?
appointment needed, correct.
And this is at your Northridge location.
Correct.
And I was going to ask, and you touched on this, that what kind of ailment or situation that you're dealing with would be a good fit for convenient care as opposed to going to a hospital emergency room.
Okay. We all have those everyday occurrences where we're coming down with a cough or a cold, sore throat, anything. Okay, always those can make convenient injuries, backache, the ones that, like I say, where we have to help decide whether or not this is something more significant if somebody's coming in with chest pains, severe shortness of breath, anything weakness, can't move one side of their body. Okay, those are all different things. And we just always try when somebody is coming in and we're doing our initial evaluation, because people are just coming in because they need help. They're not sure where they're supposed to go. We can always start from that standpoint and help direct whatever we may need to do. We have readily available the entire day lab access, CT access, X-ray, anything else that we need. We try to have it with our advanced practice providers first, our nurse practitioners and physician assistants, but there are physicians there all day long as well. And so we'll take patients to wherever we need, but that's what makes this more readily available, is we have the services available when you need it.
The way you're describing it, Dan, is it's a good starting point for a patient, and you will kind of chart their course from there.
Correct.
Because, when someone goes in, it's like, gosh, I don't know which clinic to go to. I don't know if I should go to the emergency room. I don't know which doctor to see. I don't know if I should make an appointment. And this kind of just gets the ball rolling on a lot of those questions.
They're coming in because they need help. We're there to help. And so wherever it takes us from that standpoint in our evaluation or workup or anything else with it, then we'll either take care of it or we'll help decide what else we may need to do.
It mentions here in my notes, Dr. Dan, that you do not have to have an established relationship with Prairie Lakes Hospital to visit convenient care.
Correct.
So maybe you've never been there before and you're wondering, okay, are they going to take me? Don't worry about that.
Don't worry about it. And whether you're a patient there or not, we will take care of you.
And this is exclusive to the Northridge Clinic location, is that right?
Our primary care has two buildings, our main building and the Northridge site. And we're trying to make it as readily accessible as we can and convenient as we can by keeping it in one spot, because that's where we have the majority of our other X-ray technology and everything else, so we can progress things through much faster.
And obviously the Northridge Clinic, I think most folks know that's up on 14th Avenue North on the north side of town.
Correct.
The staff, Dan, the folks that staff the convenient care at Northridge Clinic, is that on a rotational basis, or how does that work?
Typically the same people are going to be there every day. One person is designated for sure as that first person for anything for walk-in, anything else beyond that, okay, it's dispersed. Whoever has openings, and we'll take as they come. It's all aboard, everybody's involved, we do what we need to do.
And from your standpoint, you don't know how busy one day might be from the next or what people might need to be seen for, right?
And that's exactly true. So part of it is, okay, I'll just caution patients when they come in, okay, we will get to you as soon as we can. Okay, you can always have that scenario where one day you may just be standing there and you can walk right in and be taken care of. The next day, 20 people will walk in at the same time. Okay, we'll get to everybody when we get to you. We promise we will take care of you, but like I said, you can't staff for every possible scenario. So we think we're doing a pretty good job as far as getting close to that.
Sure.
And taking care of those high points, typically that 7:30 in the morning where you get that rush before school. Should they go to school? Should they not go to school? Over the noon hour when people are off or they have their lunch break and said, okay, I can get in at this point, or after work. And so that's why we're there till 6 o'clock.
It seems like this time of the year, Dan, it's the time of the year where we're getting on the front end of the influenza season. Are we seeing much activity yet?
It's going in streaks. I'll say we haven't had much for influenza yet. We've had some bursts of COVID, and now we're seeing some increase in whooping cough.
Oh, what is that and how is it treated?
It is a bacteria, so it's treated with an antibiotic. It'll start off just like any other respiratory infection, having a cough, cold, congestion, but then you'll have these episodic coughing spells where they get more uncontrolled with it, and it really sounds like somebody whooping. So that's how I got the name of whooping cough with it. So Sioux Falls and Brookings are having quite a few. We've had several of them here in Watertown already. We're on the lookout for it. We're aware and we're testing, so that way we can come up with the best treatment we can.
Is it highly transmittable?
Yes. So it would be just as contagious as anything else like COVID or influenza or anything else that's a respiratory illness. So
You are just about 1 year into the merger between Brown Clinic and Prairie Lakes. How's that gone?
Great. As far as I can tell from the standpoint of primary care, it has been no change. We're taking care of patients like we've always been.
And that's the goal every day. All right, Dan, in review again, tell us about convenient care, where it's at, the hours, and what people can be seen for at convenient care.
Okay, it is at our Prairie Lakes Brown Clinic Northridge site. Starts at 7:30 a.m. until 6 p.m. Monday through Friday. Any type of acute illness, colds, coughs, cuts, bruises, anything. And again, if you're not sure where to go, you can always start with us first and we'll help with that. But we are there to help.
Back to influenza for a second. Is now a good time to get a flu shot? Are they available?
Absolutely. Anytime. If you haven't gotten one yet, the only time it's too late is when you come down with it.
Are we still dealing with COVID at all in your world?
Yes.
We are.
Every week.
Every week?
Every week.
Really? How has it changed since a couple of years ago?
People have been immunized or they've had the disease already. And so we've built up that immunity with it. So the strain of the virus has also changed. So anytime it's a new one, it is much more significant as far as how it will affect our health. And so that part is at least tapered down from there, but it is still present and we're seeing it on a regular basis.
I've heard people say, Dan, that once this virus gained hold on the populace, that it's here to stay and it'll never go away. Is that, you think that's accurate?
Correct.
It is.
And they keep coming out with the vaccine every year. It will be just like the flu vaccine. It will be once a year.
And where can people get flu shots at as far as Prairie Lakes goes? Can they get them at Northridge, at Convenient Care?
Yep, they can get it at our Convenience Care. So in general, our Prairie Lakes Northridge site, our main site, they're there the entire time. We'll have some people that come in and say, I just want a flu shot. Yep, come on in and get one.
Sounds good. Dan, good to see you again.
Okay,
thank you, sir.
Thank you.
You betcha.
All right.
That's Dr. Dan Reiffenberger from Prairie Lakes Healthcare with us on What's Up on KWAT.